What if I told you that the new tax bill, yes, the one being called Beautiful, actually might make it harder for you to get the care when you need it? Or that the nurses, the doctors, the caregivers, people that you know could be forced to work even more with even less? And today, yes, we are definitely going there, because this isn't just a news headline. This is about a system that we are trying to survive inside. This is about how things just got heavier, especially for middle class working people like you and I, and also for healthcare workers, and especially for women. If you're new here, my name is Naisha Nicole, so welcome. And if you've seen my face before, you already know that we're locked in. And around here, we talk about all things growth, boundaries, and healing. And we also talk about the things that's real, the things that's happening today, the things that affect us every single day. And today, we're going to talk about this tax bill because it's real. It's big for sure, and it's going to affect a lot more people than you actually think. And if you didn't know, I am a nurse practitioner, and that's why it's definitely important, and I want to get the message out. Because at the end of the day, I am a woman, and I'm tired of watching broken systems expecting us to somehow hold everything together and smile through the pain. So no, we're not going to do that. So I want to break it down, and I want to do it human to human. And I'm not going to use any type of jargon. This is not going to be any fluff. This is just going to be the truth. So let's dive in. This new bill by President Trump is, if you can think of it like a massive money plan, except for instead of budgeting for, groceries or gas or anything like that, this is how the government is going to decide where the money goes. So if you can think of the bill like that, we're already off to a good start. So this plan, it makes huge cuts to healthcare programs like Medicaid. And if you're not familiar with Medicaid, just to kind of get you up to speed, Medicaid is a government-funded health insurance for people who are like low income or elderly or disabled or pregnant, for example. And many hospitals, especially the smaller rural hospitals, use Medicaid and take on Medicaid patients, and it makes a huge portion of who they are as a hospital community. So when money gets cut, the hospitals are going to struggle. Patients, unfortunately, will get left behind, and the weight is going to shift. And guess where it's going to shift? Onto the back of not only healthcare workers like myself, not only women like myself, but is going to shift on people already stretched too thin. So let's talk about what this looks like in real life, because sometimes people need real life examples in order to understand where the people that are upset about this particular bill are coming from. So I'm going to give you a real life example. Imagine a rural hospital. Let's say you live in a town that may only have, 1,000 people or 1,500 people, and everybody goes to the community hospital. I know because I used to rotate in a community hospital, in a rural hospital. Well, the hospitals that I used to rotate in, the hospitals that you may go to, they could possibly shut down completely. And that would leave entire counties without ER access. And so I want you to look at it from this perspective. I want you to imagine having to drive an extra 45 minutes because you're having stroke-like symptoms, or you've fallen out of a tree, or you've experienced some sort of trauma. I want you to imagine having to drive an extra 45 minutes. That's not just inconvenient. That's deadly for somebody that's maybe having a stroke where, Tom is brain, or someone that's maybe having a heart attack where Tom is their heart muscle decaying or dying, right? And I also want you to think of it like that's your mom, or that's your brother, or that's your cousin, or that's your sister, or that's somebody that you care about that's having to take a 45-minute drive, in the middle of possibly having a stroke, where, Tom is so valuable in those instances, right? I want you to think about a mom who works two jobs, in fact, but can't afford the insurance that maybe their employer offers because she's already living paycheck to paycheck. And so she's on Medicaid, and let's just say she missed a piece of paperwork that could have been an easy fix. Well, she's going to be dropped from having Medicaid. And I know what you're going to say. Well, she should have all her ducks in a row. Right. I agree with you, but that still doesn't take away that this person is going to lose healthcare insurance for something that, is a piece of paper, right? And this person still needs care. This person might need, help with her blood pressure. This person might need checkups. This person might need birth control or whatever it may be. And she's going to show up to the clinic expecting to get care. But guess what? The staff that's there, they're already understaffed because you're going to have to cut back staff in order to keep, community hospitals afloat. So that means that the staff that's already there are probably underpaid, right? But they're going to help her. But this is going to make them have to have overtime in order to help her, which eventually leads to emotional and physical burnout. Right? And maybe you're thinking on the other end, well, I'm not on Medicaid, no big deal, so I'm good. That's where you're wrong. Because when millions of people lose coverage, they don't just disappear. Those people don't just go poof and they're gone. They're still a part of our community, right? They'll show up in the emergency room where the cost of care from an emergency room is going to get passed on to who? To you. It's going to get passed on to me. It's going to get passed on to millions of other hard-working individuals in this world. And that means that you're like, well, I'm not going to have to worry about it. Well, if you have private insurance, yes, you will, because that means that the insurance companies are going to raise their premiums. Right? You're going to have higher premiums, longer wait times to get important appointments, longer wait times in the ER. You're going to have overworked providers. And this is just my opinion because I am a provider. And so I feel like I feel comfortable with speaking to this. If you have an overworked and underpaid provider, you are dealing with a dangerous person, because that's when mistakes are made. That's when people don't get the proper care that they deserve. So this will affect all of us, not just a small population of people. And it's unfortunate that there are people that's out there that think that is not going to affect them. It is going to affect this whole entire, United States of America. And, and it's because healthcare, it doesn't just live in a vacuum. And I think that's the point that people are missing. Healthcare affects everyone, everywhere across this world. Now, let me speak from my heart, from working in an acute care setting, from having been in clinics. This bill isn't just a policy shift. It's another layer of emotional labor, of emotional burnout, of being in survival mode for people in healthcare, especially women, and especially women of color. And, here's what happens when Medicaid gets slashed. We see more uninsured patients, like I said earlier, with serious chronic conditions that will only get worse because they have had to delay care for far too long. People that live in those communities that only have, 1,000 people or 300 people, those people won't have immediate access. And what do you think they're going to do? And yes, you may say, well, they're adults and that's their prerogative, but some of them are vulnerable adults. Some of them are elderly. Some of them are your parents that you talk to every single day. Here's what else is going to happen. Clinics across the nation is going to lose funding. So because clinics lose funding, the clinics are going to be asked to do more with less staff, which means there's not going to be as many jobs available, fewer resources, and the same amount of pain that they will experience walking through those doors every single day. And the crazy thing about it is the assumption is that we're just giving meds. No, we're not. We're giving, comfort. We're giving safety. We're giving reassurance. We're giving all of that to your parents, your mom, your dad. We're giving it to your brother, your sister, your wife, your husband, your best friend, the people that you love. We're giving all of that to them. And guess what? It is exhausting. Because you're giving all of this and you're not getting the support that you need. Is very exhausting. And that kind of pressure, it doesn't just lead to burnout. It doesn't cause burnout. What happens is it causes people to leave the profession in its entirety. And guess what? You're like, oh, well, you should have picked a better profession. Maybe that's what someone might be saying. Okay, that's fine. But guess what happens when people start leaving the profession in its entirety? The same people that's saying that, you won't have somebody to provide, to give you care. We'll all feel it. It doesn't matter. It doesn't matter if I'm a provider, I'm still going to feel it, because at the end of the day, even though I'm a provider, guess what? I still have to go get care just like you. My family still has to go get care just like you. It'll be fewer providers with less access and more chaos. This whole thing ends in chaos. So, again, you may be thinking, well, I've got private insurance. Well, I have private insurance too. I don't use Medicaid. No. So, I'm sitting here not advocating for myself and for my family because they're covered, right? So you might be asking, well, why does it matter to me? You might be asking, well, why does it matter to you? Because it's not about you. It's not about me. This is about the ecosystem of healthcare. That's what it's about. And when one part of the ecosystem breaks down, there's a ripple that hits everyone. It's a ripple effect. Insurance companies will raise premiums. You can guarantee that. Wait until your open enrollment. If you have privatized insurance, wait until it's time for you to do open enrollment. I know mine's in October, and I'm already expecting for the premiums to go up. Because someone has to make up for the loss. That's the thing. And every time that there's a policy change, it doesn't matter who you support. I don't care. But what I do care about is the people. And every single time that there's a policy change, a huge shift, the people are the ones that feel it the most. Because in this situation, insurance companies will not lose money. They have to make up for the cost, and they're going to do it through you. And unfortunately, you'll have to wait weeks for an appointment because your provider is booked solid. I know that moving forward, that my clinic is probably going to be booked solid. I'm probably going to be booked through next year. And I know that. Or, you're going to be burnt out and you're going to be gone. That's just what's going to happen. The emergency rooms are going to be the only place that's left for people that don't have access to go. And they're already overcrowded. Like, have you seen emergency room wait times? They're already overcrowded, underfunded, and overwhelmed because no one wants to work in an emergency room because you don't have enough staff, right? And beyond all of that, this shows us how easily systems will affect the most vulnerable to protect sometimes the most powerful. And I can speak to this because I too have a son that has a disability. I do. And the unfortunate thing is that if I and my family, if we were in the position that we are in, and I thank God every day that we're in this position, but at any point in time, even the position that I'm in can be gone like that. Even the position that you're in, you may be making over six figures and that can change like this. And there's no program to help you. And that's just real talk. And I feel like as a society, as people, as providers, as everyone in healthcare, like just everyone across the world, we have to start paying attention to that. And when you live in this world of feeling like things aren't going to affect you, you have no clue. You have no clue. And, you know how I am. I'm always going to teach something, provide some sort of value, and not just rant. So I know how easy it is to feel helpless. I know. And when you hear things like this and you hear the masses talk about this bill, I get it. It's so easy to feel overwhelmed. I'm with you. But here's what you can do right now in your everyday life. And again, I'm not a tax specialist. I'm not, a politician, or I'm not any of those things. What I love doing is helping people. That's what I love doing. And so the biggest thing that you can do in your everyday life is stay informed. How can you know and prepare for something if you don't know what's going on? Keep learning about this bill. The more details continue to come out, and check and recheck sources. Like, don't take my word for it. You go and you research on your own and watch things like this YouTube video, watch things like other YouTube videos to get informed and be able to, at the very least, listen to people that are looking at this bill and that's studying this bill so that you can be informed. So yeah, stay informed. That's the first thing. Number 2 is talk about it. Share this video with someone. You talk about it with someone. You text your mom, or you text your dad, or you text your sister, because honestly, you may not know if any of your family members are going to be affected. And maybe you have this mindset that everyone's good, but that's not always the case. So talk to people. Get in a group chat. Talk about this. Because these conversations that you have with your family and with your close friends and everyone, it helps. It truly does. And the third thing, and the most important thing is support your local clinics. It doesn't matter whether you volunteer. Sometimes you don't need to give money. Sometimes your time is more valuable than the money that you actually give. How about not skipping appointments? That is how you help support your local clinic. If you set an appointment with your local clinic, go to that appointment. Don't miss it. Because at the end of the day, your presence, it does matter, and don't let anybody tell you any different. It does. You don't have to change the whole entire world overnight. That's not what I'm asking you to do. I don't think that's what other people are asking you to do. No, but staying informed and staying awake to what's actually happening, that's the start, and that's where the real power is. So, this tax bill, honestly, is not about the numbers. It's not about the great things that it can offer to a certain, group of people. No, it's about real people. It's about the everyday working human being like me and you. It's about our vulnerable population that don't have a choice, right? It's about real hospitals. It's about real moms. It's about real grandmothers, real wives, real husbands, real children, real healthcare providers. It's about all of that. And it is about the silent ways that somehow women keep paying this price, and people keep paying this price for a system that they didn't break. It's the truth. We all pay a price, and the price is different, but none of us has caused this system to break. So I look, if you felt this one, if something in your mind clicked, please let me know in the comments. please let me know in the comments. And I want you to share your story. Tell me if this bill is going to affect you, because I honestly believe that this is going to, hit more people than they can actually see. And so I want you to tell me in the comments, like, what are you doing to prepare, prepare for this bill? Because I do know that President Trump did sign the bill, not that maybe a few days ago. So let me know what you're doing to prepare for, the ripple effect that's going to happen with this bill. And honestly, don't forget to subscribe to this channel for more conversations, not just like this and not just about healthcare, but about healing, about growth, and about real life things, about power and how to restore your power. Because around here, what we focus on is growing. We focus on getting informed, and we don't, stay silent about anything ever. Because if you don't know, how can you try to help, or how can you try to change? So that's what we do around here. You already know that. You already know that we are locked in 100%. We're locked in, and I appreciate each and every last one of you. And, again, I thank you for being here. My name is Naisha Nicole. Like, comment, subscribe. Peace.